Hello students, let's study about blood cells, that is RBCs, WBCs and platelets. RBC, also called as erythrocytes, that is red blood cells. They are anucleated biconcave cells, and normally in male they are 4.5 to 6 million cells, and in female 4 to 4.5 million cells per cubic millimeter. If the RBC count is increased than the normal range, it is called as erythrocytosis. It is seen in hemoconcentration due to diarrhea or vomiting, burns, cholera, high fever, exercise. In cyanotic states like chronic heart disease, in polycythemia also we can see erythrocytosis. If the normal range of the RBC count is low, it is called as erythrocytopenia. It is seen normally in old age, pregnancy, anemia, pancytopenia. The next parameter from the CBC is leukocytes, also called as white blood cells or corpuscles, and they are nucleated corpuscles, and based on the morphology they are divided into granulocytes, which consist of neutrophil, eosinophil, basophil, and agranulocytes, that is granules absent in the cytoplasm, and they are of two types, lymphocytes and monocytes. The normal range in adult, it is 4000 to 10,000 cells per cubic millimeter, and in newborn baby it may be 10,000 to 25,000 cells per cubic millimeter. If the WBC count is increased, it is called as leukocytosis, and it is seen in infections like bacteria, virus, protozoa or fungal infection. If the WBC count is less than the 4000 cells per cubic millimeter, it is called as leukopenia. It is seen in typhoid fever, tuberculosis, influenza, AIDS, dengue, falciparum, malaria. So chronic conditions you can see leukopenia, and acute condition you can see leukocytosis. So fifth parameter from the CBC is differential leukocyte count. So in that, granulocytes, that is the granules seen in the cytoplasm, so they are of three types: neutrophil, eosinophil and basophil. So neutrophils are usually for 10 to 14 micron in size, and the cytoplasm contains fine pink color granules, and nucleus has the 2 to 3 lobes. Eosinophil, it is usually bilobed, and the cytoplasm contains orange coarse, that is bigger granules. Basophil, the nucleus is either bi or trilobed, but the cytoplasm contains plenty of the bluish black color granules. Then agranulocyte, so first is lymphocyte, so it is round nucleus with round cell with slight bluish cytoplasm without granules. And monocyte, the nucleus is kidney shaped, and it is biggest cell, that is 14 to 22 micron in size, and the cytoplasm is grayish blue color without granules. Now we can see pathological leukocytosis because of the neutrophilia, that is increase in neutrophil count, and it is seen mainly in infective condition, that is infection due to bacteria, virus or parasites. Then inflammatory condition like rheumatoid arthritis, acute rheumatic fever, myocardial infarction, or because of the operation, fracture, and can be seen in if the count is raised more than 70 to 80,000 or 1 lakh, it is called as leukemia. Then lymphocytosis, it is increased lymphocyte count. It is mainly seen in viral infection like mumps, measles, influenza, rubella, and some bacterial infection like typhoid, tuberculosis, syphilis. Eosinophilia, it is increased eosinophil count, and it is due to allergy to dust, drugs, or asthma, hay fever or parasitic infection. Monocytosis, it is increased monocyte count. It is usually seen in viral infection like infectious mononucleosis, then malaria, typhoid, kala azar. Basophilia, it is increased basophil count. It is seen in chronic myeloid leukemia. When the WBC count is less than 4000 cells per cubic millimeter, it may be due to neutropenia, that is decreased neutrophil count, and it is seen in bacterial infection like typhoid, viral infection like measles, influenza, in anemia like aplastic anemia, megaloblastic iron deficiency anemia, or bone marrow depression because of the chemotherapy, radiotherapy. Then lymphocytopenia because of the viral infection or typhoid or excess radiotherapy or leukemia, AIDS, anemia, pancytopenia, you can see lymphopenia. Absolute eosinophil count, so they are eosinophils total in count present in blood per microliter. So the normally they are 40 to 450 per cubic millimeter. The clinically, if they are increased, they are seen in parasitic infection, allergic reaction, and some leukemias. And decreased eosinophil count is seen in increased adrenal function. The next parameter is total platelet count. They are 2 to 3 micron size platelets seen in blood, and normally they are 2.5 to 5 lakh cells per cubic millimeter. In clinically, the platelet count is important for the investigation of bleeding disorders, and if the platelet count is decreased, it is called as thrombocytopenia, and it is associated with the prolonged bleeding. It is seen in aplastic anemia, megaloblastic anemia, acute leukemia, dengue fever, falciparum malaria. If the increased platelet count, it is called as thrombocytosis, and it is seen mainly in splenectomy patient, that is removal of the spleen, and in chronic myelogenous leukemia. Reticulocyte, it is an immature RBC which is developed from the late normoblast, and then it continues to develop into the RBCs. So the cell size is around 7.5 to 8 micron, nucleus absent, but cytoplasm contains hemoglobin in large quantity with little RNA, ribonucleic acid. Normal range of reticulocyte in adults is 0.2 to 2%, in infants it is 2 to 6%. Reticulocyte count is increase is called as reticulocytosis. It is seen in hemolytic anemia, acute blood loss, hemolytic disease of newborn, thalassemia, iron deficiency anemia. And absence or low count of reticulocytes is seen in bone marrow suppression, that is aplastic anemia. So to summarize the uses of CBC, that is complete blood cell count. So hemoglobin helps to know the anemia and which type of anemia can be sickle cell anemia, thalassemia, megaloblastic anemia, iron deficiency anemia. Then total RBC count helps in knowing the anemia, polycythemia, and then RBC different morphologies. Then total leukocyte count and differential leukocyte count helps to know the infection, inflammation, leukemoid reaction, multiple myeloma or leukemia. Platelet count helps in bleeding disorders like dengue or falciparum malaria. Then RBC indices helps for the morphological classification of anemia, whether microcytic or macrocytic. If microcytic, it can be seen in iron deficiency anemia, sickle cell anemia, thalassemia. Macrocytic can be seen in megaloblastic anemia, hemolytic anemia. Then RDW, that is red cell diameter width, is an important parameter, can be calculated only by the automated cell machine, and if it is increased, it is seen in anisocytosis, that is thalassemia, in that it is normal. So these are the uses of the complete blood cell count. These are my references from where I have taken my notes, and I hope you find this session very useful for your academics and for your future practice. Thank you so much.